Welcome to Averyon Home's medication administration video. Today, you will learn proper administration of medications, the 8 rights of proper administration, and how to keep our clients safe. I hope you enjoy our video and find it educational.
One of the most important parts of your job as a care provider here at Averyon Homes is medication administration, and there are 8 things that you need to be sure are right prior to giving a medication. Those 8 things include the correct person, and by person I mean the correct client, that you have the person sitting next to you or in front of you that is to indeed be given the medication that you're going to be giving. The next thing you want to ensure is that it is indeed the correct medication, that it's the correct milligrams or the correct dose of that medication. You want to ensure that the route that you're going to use to administer this medication is the one listed in the order from the doctor. You want to be sure you're giving this medication at the correct time, on the correct day, and those things will be found in the EMR that's located on TheraP. It'll show the day, it'll show the time that the med is to be given. You want to ensure that the expiration date on the medication itself is not a date that is any sooner than the date that you are giving the medication, to be sure that it's not expired. Proper documentation with regard to medication administration is very important, and this includes verifying the doctor's order prior to giving the medication so that you know you're going to give a medication that is indeed ordered by a physician. You also want to be sure after giving the medication to go into TheraP and properly document what you've given to which client, on which day, at which time. Some of the medications that we give are controlled substances. These substances must be counted at the end and the beginning of each shift. The person coming on to their shift and the person leaving their shift must count and verify these medications each time they work. We have a few resources when it comes to finding information on the medications that we're giving. If you have questions, you can refer to our nurse or our healthcare coordinator. You can look on the internet to find information regarding the medications. And you can look in the drug reference book located in each home for information specific to the drugs that you're having questions regarding. There may be times when you'll have a medication listed by its generic name. And an example of that would be Tylenol, which is a company name, and then acetaminophen, which is the generic version of the drug that Tylenol is. And you can find this information in the drug reference book, this one here. So if you have questions, make sure to look into this book regarding medications that are named other than the ones that are prescribed on the order. Our medications are stored in different forms in different ways, but they're always locked so as not to have access by anyone that isn't authorized to access them. When it comes to tablets and capsules, creams, ointments, things that are kept at room temperature, they're kept in a locked med box in each home in a medication cabinet that's also locked with a padlock. When it comes to insulin, this must be stored in the refrigerator and in a lockbox as well. Each client has an over-the-counter standing orders form that is signed by their doctor. On this form, it includes things like acetaminophen, ibuprofen, and the things that you would use from day to day for a PRN purpose. PRN means as needed. These medications, if they're not able to be given to the client, will be crossed out in the standing orders form that is signed by their doctor. Their allergies will also be listed under their name on this form. Should you miss a dose for a medication, there's a standing orders one-time missed dose form. There are several different ways to administer a medication. These are called routes. The first of these is orally, and this involves giving a tablet or a capsule by mouth with adequate fluid to swallow, making sure that they have a glass of water that is sufficient to swallow all of the medications that you're going to be administering. Topically involves putting gloves on and using either an ointment or a lotion on the client's skin with gloved hands. A sublingual medication is given under the tongue. A buccal medication is given in the cheek, right between the cheek and the gums. When you're doing an eardrop or an eye drop, be sure to glove up and to follow the proper instructions on the medication that you're going to be giving, whether it's in the ear or it's in the eye, making sure it goes to the proper place. With regard to nasal administration, this just involves putting a medication up the client's nose. The last administration route is rectal, and this involves laying a client on their left side with their left leg extended straight out and their right leg bent in a laxed position so that you can administer the rectal medication in a comfortable way. You'll want to be gloved for this procedure, and you're going to want to be sure to administer the medication to the second knuckle of your finger.
Now that you've learned about the routes and the rights of medications, I'm going to show you how to properly administer a medication. You want to start off by washing your hands, and then I'm going to take my medication and make sure that everything matches up on the EMR. I'm going to make sure that I have all my 8 rights and that everything matches up, and it does, and then I'm going to administer the medication. I am also going to put my initials, the date, and the time on the actual medication itself when I pop it out. Always remember that if you do drop a medication, if you drop it on a clean surface, then you can still give it. But if you drop it on the floor, you cannot give it, and then we have a little envelope that you make sure that you are documenting everything on it, what the medication is, the doctor, who it's for, and the date. And then you put it in the med destruction box. Now that we've properly administered the medication, we want to make sure that our documentation on TheraP is correct. Your PC will give you proper training in this area.
Now that we've discussed the rights of medication administration, proper narcotic counting, proper administration of medications, as well as charting, we're going to go over our healthcare policy and procedure manual that's located in each home. Within this binder, you'll find information on most medical concerns, and there is a policy for you to follow that will make dealing with emergencies or new situations easy for you to do. After you've finished your hours of training in the home, you will take a medication administration test. This is a written test. It is an open book test, meaning you can use videos provided, any written literature, as well as asking for assistance or clarification from your PC. To recap, we're going to go over some of the resources that you can use to look up a medication if you're unsure about it. You can use the medication reference book, you can look online, you can call the nurse, or you can ask the pharmacy if you have any questions about medications. There are many clients that have got pills that are very large. Please do not cut those in half. That needs to be approved by the physician as well as done by either the pharmacy or the nurse. Do not crush medications unless there is a specific order given from the doctor that it is okay to crush these. Some medications are an extended release, and if we crush them, the client may get too much of a dose too quickly. So please, do not crush or cut medication. Make sure you know the different routes. Knowing that sublingual goes under the tongue is important. It needs to dissolve, and the client should not be given water for at least 15 minutes afterwards. It's also important to note that you should only be passing medications to one client at a time. You don't ever want to have 2 clients' medications out at the same time. That can cause a significant error. And it is also important to make sure your focus is on the medications as you're preparing them. Some clients are on a self-medication program. This means that staff will take their locked box out for them and unlock it. The client will then prepare the medications themselves. Ultimately, though, it is the staff's responsibility to ensure that the client is taking the proper medication and following all of the rights, as well as charting on the medication. At times, it is needed to hold a client's medication due to health concerns. One example is loose stools. If a client is experiencing loose stools and they are on a stool softener or a laxative, it's important that those medications are then held for 24 hours. Please make sure you progress note the reason that the medication is being held and document properly on the electronic medication system. If you are working on the floor and you notice that a medication on the EMR was not signed off previously, it is your responsibility to follow the policy and procedures and follow up with the previous staff. Medication timing is important. If a medication is to be given at 8 a.m., you have 1 hour on either side to administer that medication, which means you can administer the medication from 7 a.m. to 9 a.m. Make sure that you read the progress notes and communication book at the start of every shift so you're aware of what has happened on the previous shift. If you find that your client is out of a medication, please do not borrow medications from another client. Medications are only to be given for the person listed on the medication package. There should be a 10-day supply of medication on hand for each client in the home. If you find that you have less than that, please call the pharmacy and reorder the medication. Over-the-counter standing orders have been previously discussed. I just want to touch on that a little bit so you know if a client has a headache or a complaint of upset stomach, you'll know where to look to find the medications that are available for use for that client. Please look at the over-the-counter standing orders and match up the medication with the complaint that the client has. Counting controlled substances at the start and end of each shift is important. If you find that there is a discrepancy in the count, you need to contact your PC as well as your PD immediately so they can do follow-up. If you have taken a client to a doctor's appointment and there has been a medication change, it is your responsibility to let the PC know, and the PC will then notify the healthcare coordinator. Examples of medication or treatment discrepancies that need to be reported include missing a medication, giving too much of a medication, giving a medication at the wrong time, as well as giving an expired medication. If a medication or treatment discrepancy occurs, the forms need to be filled out immediately and your PC needs to be notified, and those will all be routed to the RN. If a scheduled medication has been missed because of out of our control circumstances, you'll need to refer to the one-time missed dose standing orders. That means if a medication was due at 5 p.m. and a client wasn't able to take that medication until 8 p.m., you'll refer to the standing orders to see if that medication is still able to be given. If a medication is due at the time of shift change, the person going off shift is responsible for administering that medication. Again, ensuring we are giving one client's medications at a time. If a client is going on therapeutic leave, you will need to pre-package the correct medications for the number of days that they will be gone, or the number of hours. You will have to document this in a progress note, and it will also be documented on the EMR. However, we are not able to predate therapeutic leave on the EMR, which means that it will have to be charted at the time it is due or after the time it is due, which is not a problem. If a client is having a medical emergency and you need to call 911 for emergency room transport or for an ambulance, you will need to follow the healthcare policy and procedure manual, and that will give you a list of what information needs to be sent with the paramedics. You will also find that we will be using a lot of different abbreviations in our progress notes. DC, for instance, means discontinue. BID means twice a day. TID is 3 times a day. PRN is as needed. You will see that one quite a bit for the over-the-counter standing orders, as well as prescription medications for our clients. HS means evening, or hours of sleep, as well as BP for blood pressure, T for temp. There is a list of abbreviations available at each home. If you have questions, please reach out to your PC. Please note that this is a brief overview of general medication administration.
As a part of Team Averyon, I'd like to thank you for taking the time today to watch this medication administration training video. If you have further questions that are specific to the home that you work at, please make sure to reach out to your PC. And there's a chain of command should that PC not have the answers that you need, or if the PC is unavailable. That chain of command is available on the bulletin board in your home. Thanks so much for taking the time to be with us today, and thanks for being a part of Team Averyon.